All right. So good afternoon, everybody. Thank you for coming. I'm excited to be talking to you about food and mood and the science of nutrition and mental health. And my name is Mary, and I'm a resident at the Eastern Virginia Medical School. So this quotation is really where everything begins for me. The idea that the food we eat could function as medicine or prevent a way to prevent disease. And we know that thousands of years after this was said, there's lots of evidence that demonstrates that this is the case. So for example, we know that when it comes to blood pressure, flax seeds alone can be as effective as our first-line blood pressure medications. We know that low-carb diets can reverse diabetes. Meanwhile, there is no medication that can reverse diabetes. We know that time-restricted eating can lower your A1C more than metformin. And when it comes to cholesterol, almonds alone can lower cholesterol more than low-dose statin medications. And better yet, almonds are a cheaper way to lower your cholesterol levels. Now, of course, today we want to talk about the brain, or more specifically, mental health. And the same sort of comparison can be made in that domain as well. This is a study of the Mediterranean diet, a randomized controlled trial where they tested the effect of the Mediterranean diet on people with moderate to severe depression. And what they showed was that the Mediterranean diet could enable remission of depression in 36% of patients. Now, to put that into perspective, antidepressants on average, according to the largest cohort study ever, linking data from many trials looking at the effectiveness, it's called the STAR-D trial, showed that on average, antidepressant medications enable remission in 35% of patients. So once again, the dietary strategies that we have are often on par with the medications that we go to school for so long to be able to prescribe. And this isn't just one randomized controlled trial that has demonstrated this. There have been many randomized controlled trials demonstrating this. Now, before we jump into that, I do want to acknowledge one thing, which is that mental health is very complex. And nutrition is one piece of this large puzzle. And really, when it comes to mental health, we can never say that there's one factor that causes it. There are so many factors, which I really like to separate into two main groups. On one hand, you have your psychological factors. That's the temperament you're born with, your life experiences, trauma, all those sorts of things. But of course, on the other hand, you have these biological risk factors, things like having a brain injury, nutrition, of course, stress, exercise. Quick tangent, there's a Cochrane review that demonstrates that also exercise is as effective as antidepressant medications. But back on task, the notion that mental health is the product of a large range of factors is not at all a new concept. In 1621, a scholar at Oxford named Robert Burton wrote a 900-page treatise called The Anatomy of Melancholy. And in it, he wanted to understand what is the cause of mental health, or particularly like melancholy, what we today would call depression. And he identified 6 main things: diet, exercise, sleeping, waking, retention and evacuation, and perturbations of the mind. So I think it's interesting that the notion that something like diet and really all lifestyle factors play a big role in this is something we've known for a long time. I do want to recognize that, I'm not about here today to say that dietary changes alone are going to make this problem go away. But diet is fuel for the fire, and we have an epidemic on our hands, and anything we can do to make the situation better is going to be helpful, because diet makes the existing problems worse. And today I'm going to teach you how to manage this one particular risk factor for mental health. We're going to talk about 4 things. First, we're going to talk about fiber and probiotics. Then we're going to talk about leafy greens, then omega-3 fatty acids, and finally sugars and refined carbohydrates. So let's begin with fiber and probiotics. So the Mediterranean diet, which we know is the diet with the largest amount of evidence behind it, is effectively a high fiber diet. If you look at it, the foods that it is comprised of are high fiber foods. And research shows that the more fiber you eat, the lower and lower your risk for depression. So this is part of the reason why the Mediterranean diet has this effect. But now you're probably thinking, well, how does fiber affect mood? There's a jump that happens there with that claim. And in order to understand how fiber affects mood, we have to talk about bacteria. I bet you didn't think that that was where I was going with this. But the truth is, we all carry about 1/2 pound of bacteria around inside of us. And this is sometimes referred to as the gut microbiome. And every time you eat, you are not just feeding you. you are also feeding the trillions of bacteria that live inside of you. And we know that there's a mix of both good and bad bacteria that you carry around. And good bacteria, they love to eat fiber. Meanwhile, bad bacteria, they love to eat all those treats that we all love, but we all know we should eat less of. And the reason this is a problem and the reason this ultimately affects our brain is because 70% of our immune cells live right next door to the gut microbiome, only separated by a single wall of cells. And our gut microbiome likes to talk with our immune system, just like good neighbors. They have a lot of conversations across that fence. When you have a lot of good bacteria in your microbiome, they send good messages to the immune cells that then translate that into signals of calmness that radiate throughout the entire body. On the flip side, when you're growing more bad bacteria, they send signals of chaos to those immune cells who then amplify that signal throughout the rest of the body. So the point is, when you eat unhealthy foods, you feed bad bacteria who talk to the immune cells on the other side of the gut wall, who then release these pro-inflammatory signals. For those who are curious, I'm talking about things like interleukin-6, tumor necrosis factor alpha, and interferon gamma. And what happens is these pro-inflammatory cytokines travel throughout our bloodstreams and eventually reach the brain. Now, the problem is that when those cytokines reach the brain, they actually influence our serotonin levels. We know that increased cytokines decrease the production of serotonin and also increase the breakdown of serotonin. Obviously, this is a problem because our mainstay of treatment for depression is medications that increase serotonin. And here we have a process that is showing us how we, by our food choices every day, can actually decrease serotonin levels. Because as we all know, serotonin is our contentment neurotransmitter. This is probably why there are so many observational studies that link processed food and junk food with anxiety and depression. It's this mechanism that I just described. So what we've covered so far is that fiber feeds good bacteria, which feeds immune cells, which talk to our brain and ultimately influence our serotonin levels. The problem is we don't eat enough fiber. I forgot to change my statistic here to American statistics, but we know that the majority of people do not eat enough fiber, and we all need about 25 to 38 grams of fiber per day. So if you're a woman and you need 25, you get that from oats, an apple, lentils, and spinach. That's it. If you're a man, you need another 13 grams. You can throw in an avocado, and you can. So it's achievable to eat this amount of fiber. I often talk about this with my patients, and the way I do this is with a nifty little handout that I created that basically shows my patients on one side how much fiber they need based on their age group and whether they're a male or female, and on the other side shows them dietary sources of fiber so they can do the math. And people are often surprised how little they're getting. This is a resource that I share openly, and you can get it from my website, nutrition-prescriptions.com. And just to review, the most fiber-rich fruits include things like apples, pears, berries. Fiber-rich vegetables include broccoli, Brussels sprouts, asparagus. Legumes, beans, peas, and lentils are among the most fiber-rich foods there are. We know that among grains, you can get a lot of fiber from things like barley. I think barley is the healthiest grain there is. Also oats, brown rice has 4 times more fiber than white rice. Even popcorn has fiber. And it's important to realize that fiber supplements, though they do have health benefits on their own, do not deliver the same thing that fiber from nature delivers. So taking a supplement can be helpful for certain people, but is not a replacement for getting fiber from food. Now, there is another way that we can influence the microbiome, and that is through probiotics, or the ingestion of good bacteria directly, which you can get from supplements and also from various food products. Because instead of feeding the good bacteria, you could just put the good bacteria in. It's sort of like a theoretical shortcut. What I think is fascinating is the idea that this is actually not a new concept at all. We know that this is an advertisement from the New York Times from, what was the year? 1932. And what it showed is that at that time, there were companies marketing probiotic milk as a means to actually improve your mood. If you look at this ad in detail, you can see they're talking about these friendly bacteria and how your doctor will agree that your mood towards things in general is largely influenced by the condition of your intestinal tract. So the idea that eating good bacteria influences your mood is an idea that's been around for nearly a century. And we have meta-analysis data that shows that probiotic supplements can influence depression, albeit the effect sizes are very, very small. So it's not necessarily the thing that I would recommend first to people. This was a study where they compared decreases in depression scores when they gave a probiotic and prebiotic supplement alongside an antidepressant. And what they showed is that the decrease in depression was, greater when you had this supplement, but it wasn't that big of a difference compared to the antidepressant medication alone. Of course, another place where you can get good bacteria is from fermented foods. Lots of observational data has shown that eating fermented foods is associated with mental health, but we don't have any randomized controlled trials illustrating this, except for one, which is a randomized controlled trial testing the effect of a fermented milk drink. And what they showed is that just adding 1/2 cup per day of this fermented milk drink could decrease depression rating scores by 1.71. Meanwhile, antidepressants decrease it by 1.94. So the fermented milk doesn't perform better than the antidepressant medication, but it comes very close. So I think that's still quite interesting to be aware of. In this study, they even specifically showed that eating the fermented milk drink actually decreased levels of interleukin-6, which is one of those chaotic inflammatory cytokines which can reach the brain and influence serotonin levels. I also want to mention something interesting about this study, which was that it was specifically done on people who were depressed with constipation. And I think this is interesting because it really illustrates how the gut-brain connection is very, very real. We have lots of observational data linking depression and constipation, hence this connection. And when we look back to 1621, Robert Burton also identified that this played a role. He identified that retention and evacuation, he's talking about constipation there, plays a role in mental health. So one of the most important lessons from today's talk is that if you want to fix the brain, you have to feed the gut. And the most important thing that you need to feed the gut is fiber. So to recap this first section, we know that the Mediterranean diet, the diet with the most evidence for influencing mental health, is fundamentally a high fiber diet. We know that the more fiber you eat, the lower your risk for depression. We all carry 1/2 pound of bacteria inside of us. When we feed the bad bacteria, we increase the production of pro-inflammatory cytokines that travel to our brain and destroy our serotonin. But every time we eat fiber, we feed the good bacteria, and our richest sources of fiber are things like legumes, vegetables, fruits, grains, nuts, and seeds. Probiotics are a way to sort of a shortcut to doing this, but their effects are only modest as per the evidence. And ultimately, if you want to fix the brain, you have to feed the gut. So moving along, let's talk about leafy greens. This is a study where they wanted to identify antidepressant foods. And the way that they did this is they said, let's look at the core, 34 nutrients that are required by humans, and let's see if we can find which ones are associated with depression. And they found that 12 nutrients were associated with depression in the literature. And then what they did next is they said, well, which foods contain the highest concentration of these nutrients? And what they found is that the #1 food with the highest concentration of antidepressant nutrients is dark green leafy vegetables. This is not surprising to me, and I'll tell you about that in a moment. When you look at the Mediterranean diet, what do you see? Vegetables are the mainstay, and particularly dark green leafy vegetables are a staple food in the Mediterranean diet. I do want to mention that cruciferous vegetables were a close second. Liver was also very high up on the list, but I'm not going to get into that for many complicated reasons. But it's interesting because dark green leafy vegetables, they have the highest concentration of these antidepressant nutrients. They're also a food that has been a staple recommendation in our dietary guidelines for almost a century. This is the US Food Guide from 1943. And what you can see is that the top group in this food guide is green and yellow vegetables. It's the #1 group that they were telling people in the 1940s that they needed to eat every single day. And we see something similar. This is a food guide from a few years later. Same thing. Dark green leafy vegetables are once again emphasized. This is a poster that hangs in the cafeteria in one of the hospitals where I work. And it caught my eye the other day, and I took a look, and it's actually created by the Works Progress Administration, which was part of FDR's New Deal in the 1940s. And again, if you read it closely and you look down, it says specifically vegetables, green or yellow. So this notion that dark green leafy vegetables are essential for human health is something that has always been recommended to us. This is partially because 51% of Americans are deficient in vitamin A. Dark green leafy vegetables are very high in a nutrient called beta carotene. Now, this is related because we know that our body converts beta carotene into vitamin A. So therefore, dark green leafy vegetables are a great way for us to get this nutrient that we don't get enough of. And of course, vitamin A was also one of those 12 antidepressant nutrients. Beta carotene, which our body can convert into vitamin A, is ultimately the product of a much larger family of nutrients called carotenoids. And carotenoid-rich vegetables are your red, orange, yellow, green vegetables. And they are also associated with decreased risk for depression. This is a study I love that shows that the more carotenoids you eat, the lower and lower your risk for depression. But there's an important thing that you need to realize about carotenoids, which is that we cannot absorb them without fat or oil. So this is a study where they compared eating a salad alone with fat-free dressing versus eating a salad with a fat-containing dressing that was equivalent to 2 tablespoons of oil. And what they showed is that you could absorb 40 times more beta carotene if you ate that salad with the fat-containing dressing compared to the fat-free dressing. So the moral of the story is fat-free dressing is not a good idea. You're actually not going to get the nutrients that you could from the vegetables that you put that dressing on. And to really drive this story home, I want to talk briefly about Popeye. So Popeye, the lovable cartoon character, is famous for liking spinach. And it's interesting, Popeye was created in the 1930s at a time when spinach sales were actually very low. And spinach was a homegrown crop, and there was a lot of incentive to get people to eat more spinach. Plus, the scientists had also already discovered vitamin A by then and also understood that it was a way to get that. So Popeye was this effort to actually increase society's spinach consumption, and it was a very successful effort. After Popeye came on the market, spinach sales increased by 30%. The spinach industry was actually saved by Popeye, and there's even a statue commemorating him in Crystal City, Texas, which is the spinach capital of the world. But what I think is most interesting is that Popeye doesn't only love spinach, he also has this girlfriend named Olive Oyl. And I think that's an interesting coincidence because, as we know, you got to eat your spinach with your olive oil for optimal nutrient absorption. So to remember the importance of leafy greens being eaten with spinach, you can think about Popeye. And once again, when we look at the Mediterranean diet, what do we see? Vegetables and olive oil. So 2 things that are meant to be together. This is a pair of socks that I saw at a store in San Francisco, and I thought it was kind of funny because they obviously say romaine calm and they depict romaine lettuce. And I thought, well, it's actually kind of clever because if you ate more dark green, that dark green leafies like romaine, you in fact may be calmer. So to recap, leafy green vegetables contain the highest concentration of antidepressant nutrients. We know that green leafy vegetables have always been recommended as a staple food for human health. The reason they're so important is because they contain beta carotene, which our body converts to vitamin A. It's a nutrient that 40% of more than 50% of us are deficient in, and that has been identified as an antidepressant nutrient. We know that the more carotenoids you eat, the lower your risk for depression. And finally, we know that carotenoids can't be absorbed without also eating some kind of fat or oil. All right, our next topic is omega-3s and their role in depression and anxiety. So let's start by just talking about what omega-3s are in the first place. So in order to understand omega-3 fatty acids, I'd like to introduce you to this thing that I call the dietary fat family tree. And this is a framework for thinking about all the different types of dietary fat and how they're related to one another. The first branch point in the dietary fat family tree is your saturated fats versus your unsaturated fats. Now, saturated fats are things like butter, lard, the kind of fat you get from beef or dairy products. Within the category of unsaturated fats, we have another branch point. On one hand, we have the MUFAs, or monounsaturated fats. That's the kind that you get from olive oil and from avocados. But on the other hand, you have your PUFAs, or polyunsaturated fats. Once again, there's another branch point. There are 2 main types of PUFAs, your omega-6s and your omega-3s. Omega-6 fatty acids come from vegetable oils, things like canola oil, corn oil, safflower oil, sunflower oil. And on the other hand, you have omega-3s. But once again, there's a bunch of different types of omega-3s. You have the type you get from plants, the type you get from salmon, and the type you get from plankton, which is where the salmon got them from. So today, our conversation is going to focus on these omega-3 fatty acids, but we're going to start our conversation with saturated fat. Because we know that for most of North American history, people ate saturated fat. This didn't change until 1888 with the invention of the first mechanical screw press. So the invention of the mechanical screw press what it did is it enabled humans to extract oil from seeds in quantities that were never before possible. This technological innovation not only changed the food industry, but also changed us fundamentally and biologically as human beings, because for the first time we could extract oil from seeds, but that also meant that seed oils became a staple of the American diet. And seed oils contain omega-6 fatty acids. So for the first time in human history, we started eating unprecedented amounts of omega-6 fatty acids. For most of human history, people ate equal amounts of omega-6 and omega-3 fatty acids. With the invention of the mechanical screw press and the movement of these omega-6 oils into our diets and onto our store shelves, today we eat 15 times more omega-6s than omega-3s. In order to understand why this is a problem, I want you to think about the fact that you literally are what you eat. And I want you to think about every single cell that your body is made up of. Because as you probably learned in high school biology class, every cell is surrounded by a membrane or a lipid bilayer, also known as the phospholipid bilayer, right? And we know that every phospholipid is comprised of a phosphate head and 2 fatty acid tails. Guess what those fatty acid tails are made from? Well, fatty acids, things like omega-3 fatty acids or omega-6 fatty acids. Research shows that the more omega-3 fatty acids you eat, the more omega-3 fatty acids that get taken up into your cell membranes. On the flip side, if you eat more omega-6 fatty acids, you take up more and you store more omega-6 fatty acids in every cell in your body. So you literally are what you eat, and we are all increasingly comprised of omega-6 fatty acids. Why is this a problem? Well, let's go back to this framework again. Remember how the microbiome, the bad bacteria could talk to the immune cells and increase the creation of these pro-inflammatory cytokines? Well, guess what? When our cells release these omega-6 fatty acids from their membranes to communicate with the rest of the body, those omega-6 fatty acids tell the immune cells to release the cytokines to go to the brain that destroy serotonin. So this is why omega-6 fatty acids are problematic, or at least one reason why. We consider omega-6s to be pro-inflammatory because they increase the creation of these pro-inflammatory cytokines. And some people think of that as being like a fire inside the body. So if we use that analogy for a moment, what I also want you to recognize is that omega-3 fatty acids are anti-inflammatory because they are the extinguisher that put out that fire. This is why research has shown that eating fish or omega-3 fatty acids is associated with decreased risk for depression. And once again, if you look at the Mediterranean diet, what do we see? We see that fish, particularly salmon, is emphasized and recommended to be consumed 2 times per week. But it's important to realize that not just any kind of fish contains omega-3s. Only certain fish contain omega-3s, and those are salmon, herring, mackerel, sardines, and anchovies. If you ate 3 ounces of any one of these fish, you would get a roughly equivalent amount of omega-3s. And going back to the Mediterranean diet for a second, part of the reason olive oil is so important and is such a staple is because if we look back at the dietary fat family tree, eating olive oil does not change your ratio of omega-6 to omega-3 fatty acids. You can eat as much olive oil as you want, and it doesn't affect that ratio. So this is another reason why the Mediterranean diet is healthy, is because you're not eating those seed oils, which are then disrupting the ratio and disrupting the balance of the fire to the fire extinguisher. So to recap, we all eat too many omega-6 fatty acids, and we literally are what we eat. So when we eat too many omega-6s, our cells are made of more omega-6s. And this is a problem because omega-6s are pro-inflammatory, and it enables our cells to communicate inflammatory messages throughout the rest of the body. But omega-3s are the fire extinguisher that put out those fires. And if we increase our omega-3 intakes, that is associated with decreased risk for depression. We know that the best place to get omega-3s from is salmon, mackerel, herring, sardines, and anchovies. And the Mediterranean diet for this reason, recommends 2 servings of fish per week and also olive oil as your choice of fat instead of vegetable oils because that doesn't disrupt the ratio. Now, finally, let's talk about sugar, refined carbohydrates, and anxiety. This is a billboard that I think is very accurate. Sugar indeed does make us feel very happy. And this is because for most of human history, life was all about procuring enough food or energy for survival. And this is because human survival depends on the acquisition of sufficient energy. And every time we eat, our body rewards us for eating because that enhances our survival by releasing dopamine in our brain. And we all know dopamine is a happy neurotransmitter. It makes us feel good. This worked very well in prehistoric environments where food was scarce, because if you're a caveman and you want to eat some grass, you get a little bit of energy from that grass and your body gets a little bit of dopamine. But what your body really wants you to do is to go out and find that apple, because that apple contains more energy. And when you get more energy and you eat more energy, your body is happier. You release more dopamine to reward your body and make your body motivated to go and find that energy again in the future. But how does this work in our modern day food environment? It doesn't work, because we can eat an apple and get a little bit of dopamine, but at the same time, we can also eat something like a cupcake that contains lots and lots of energy. And what happens in our brain? We get lots and lots of dopamine. So we're being rewarded to eat the wrong food. And this is where things break down. If we flip this around and think about it from a blood sugar perspective, I want you to think about what's going on inside your body in terms of blood sugar levels when you eat something like a cupcake. So you start off, you're at your baseline. Blood sugar levels are normal and steady. But the cupcake causes your blood sugar levels to spike because the cupcake contains a lot of sugar. For the short term, you feel very, very happy because you're getting dopamine in your brain. But of course, what goes up must come down. And eventually, those sugar levels come down, sometimes lower than baseline. Now you don't feel so good. And then, of course, with time, things re-equilibrize and you feel fine. Part of what controls this process is a hormone called insulin. Every time you eat sugar or any kind of carbohydrates, your body releases insulin. And just to recap, carbohydrates include bread, rice, macaroni, noodles, potatoes, cereals, baked goods, crackers, and chips. All of these foods stimulate the release of insulin. Insulin performs a very, very important job because insulin brings our blood sugar levels down by enabling the sugar that we just ate to enter all the cells of our body, our brains, our muscles, everywhere where it needs to go to be used for energy. But the problem is, if you eat lots of carbs and sugar, your body releases lots and lots of insulin. Too much insulin brings your blood sugar down lower than necessarily your body wants it to. Now, hormones are like dominoes, and every time your body releases one, there's a cascade of many others that are also released. We know that every time your body releases insulin, it's just a matter of time before your body may also release adrenaline. That is because adrenaline is the counter-regulatory hormone to insulin, whereas insulin causes your body to soak up all that sugar and remove it from the bloodstream. Adrenaline helps your body put a little bit of sugar back in when it's needed to bring your sugar level back to baseline. So adrenaline plays a very important role in that it helps regulate our blood sugars, but the problem is adrenaline also makes us feel anxious and worried, and it makes us ruminate, and we don't feel so good when we have more adrenaline in our body. This is from a study that compared hormone levels following the ingestion of different types of carbohydrates. And what they showed is that adrenaline levels peak 4 to 5 hours after refined carbohydrates and sugars are eaten. So to recap all of this, when you eat sugar and refined carbohydrates, your body releases insulin, which then stimulates the release of adrenaline that ultimately produces anxiety. And many, many correlational studies have demonstrated this. There are randomized controlled trials in the works, but they haven't come out yet. But this is all in keeping with basic human physiology. I also want to mention that everyone is unique. Sugar and carbs aren't going to provoke anxiety in everyone, just like some people can eat whatever they want and never gain weight. Some people are going to be at risk for this, though. We know women are more prone to these effects. People with diabetes or people with prediabetes or even people with a family history of diabetes are going to be less able to handle their sugars well. We also know women with PCOS and people with fatty liver disease might also be more prone. Now, despite everything I've said, my goal today is not to tell you to never eat carbs and sugars ever again. I love carbohydrates personally, and I would never do that. But more importantly, we want to understand how to eat these foods in a way that makes sense and is strategic. So we can take a blood sugar spike that looks like this and actually turn it into a blood sugar spike that looks like this, sometimes without even changing the food we're eating. Let's talk about that. So when it comes to mitigating the effects of carbohydrates, I have a little framework that kind of almost works out to be the 5 Ws, but not quite. We're going to talk about what kind of carbohydrates you eat, who you eat those carbs you with, how you eat them, when you eat them, and why you eat them ultimately determines the effect of those carbs on your body. I don't have a where, but we're going to go with this framework anyways. Let's start with what type of carbs are being eaten. The best system that ranks carbs according to their blood sugar raising potential is this thing called the glycemic index. It was actually invented at the University of Toronto in the 1980s. This is a picture of me with the inventor of the glycemic index. He was on my thesis committee. So what the glycemic index teaches us is that when you eat something like white rice, which is highly processed and refined, you get a spike in blood sugar. This causes your body to release a ton of insulin in order to bring your blood sugar levels back down to baseline. On the flip side, parboiled rice has a lower glycemic index. So when you eat parboiled rice, you get a milder increase in blood sugar, you get less insulin released, and then a more gentle recovery to your baseline. This is why parboiled rice is considered a low glycemic index food and has a lower number, whereas white rice is a high glycemic index food and has a higher number. The glycemic index ultimately ranks all carbohydrates from 0 to 100. Lower is better, higher is worse in terms of their blood sugar spiking ability. Again, this is a handout I share with my patients all of the time because I'm not telling them don't eat carbs. I want them to understand which are the carbs that spike their blood sugar and which are the ones that don't. And again, you can get this guide from my website, nutrition-prescriptions.com. The glycemic index is interesting because it teaches us things that we would never realize. So for example, al dente pasta has a significantly lower glycemic index compared to overcooked pasta. Boiled sweet potatoes have a lower glycemic index compared to boiled white potatoes. And this is my favorite one. Depending on the shape of the macaroni, we know that the glycemic index can vary. So farfalle or bow tie pasta have a lower glycemic index than penne pasta. Research has shown that eating high glycemic index foods is associated with increased risk for depression and anxiety. So moving along, what about the who? Who are the carbs being eaten? How does this affect blood sugar levels? Well, we know that if you eat carbs with protein, guess what? You get a lower blood sugar spike. And the more protein you eat with your carbs, the lower and lower that spike is. Same goes almonds, another source of protein, does the same thing. This is because different foods are digested at different rates. We know that carbs are digested the fastest, protein is in the middle, and fat is digested the slowest. So by mixing protein or fat in with your carbohydrates, you slow the digestion of the carbohydrates and bring that blood sugar spike down. So I'm not endorsing this, but it might be a little bit of an excuse to butter your bread because we know that putting fat on the bread, guess what? Lower blood sugar spike. Although if you look at the number, 13% is not as low as the 20 or 30% that you can get with combining carbs with protein. Another one that I love to show, adding cheese to your macaroni. Now you've added cheese has protein, cheese has fat. You bring down the glycemic index of that macaroni. So macaroni and cheese could be theoretically healthier, at least in terms of glycemic index, than macaroni alone. Same thing goes for baked potatoes. Cheese on your baked potato, lower glycemic index than a baked potato alone. Moving along to how the carbs are being eaten. We know that if you eat carbs before a salad versus eating salad before eating carbs, you get a 33% lower blood sugar spike. It's the same food. You're just changing the order that you ate it with. Part of this is because salads, which contain vegetables, also contain fiber. And soluble fiber, when it gets into our GI tract, dissolves with water into a gel. That gel traps sugar and slows its rate of absorption and its digestion, and ultimately decreases the blood sugar spike. We know that eating fat or oil before you eat carbs can also lessen a blood sugar spike, as illustrated here. And vinegar can also do the same thing. Why is that? It's very interesting. Vinegar is acid. And we know that acid denatures protein. You probably remember that from like first year chemistry or something. Our digestive enzymes are proteins. So when we introduce acid, we denature the protein, we unfold it. Guess what? It's now non-functional. If you have fewer carbohydrate digesting enzymes, you can't digest your carbs as fast, and thus your blood sugar spike can't be as large. So if we think about these things that reduce blood sugar levels, vegetables, oil, vinegar, Really, this all sounds like a salad, and research shows that a salad just with olive oil and vinegar can eaten before carbs lowers the blood sugar spike by about 33%. So pretty impressive. So our cultural sort of practice of eating salads before or as the first course of the meal, you can see scientifically is actually a very, a very good choice and a very valid thing to do. Moving along with further things about how the carbs are being eaten, this is in one of my favorite studies because it shows how just changing up the order that you're eating food can significantly impact the resultant blood sugar spike. So let's say you're eating rice, chicken, and vegetables. If you eat the carbs first, you get a certain blood sugar spike, right? But what if you just eat them all at the same time? So just to kind of like mix up, maybe in a stir fry or something like that. Just doing that, just eating the carbs at the same time brings your blood sugar spike down by 26%. What if you eat the vegetables first and then the carbs and the protein mix together? Now you've brought your blood sugar spike down by 36%. What if you eat the protein first and then the carbs and the vegetables mixed together? Now you've brought your blood sugar spike down by 41%. And the best way to do this is to eat your vegetables first, then eat your protein, and then eat your carbs. And if you eat in this order, you bring your blood sugar spike down by 42%. So as you can see, it's not what you eat that matters, it's how you eat it, because this is the exact same food being eaten, just in different orders. This also illustrates how our cultural convention of having a bread basket as an appetizer is somewhat problematic from a blood sugar point of view. So it's not about telling patients, don't eat the bread from the bread basket. It's like, if you really want to eat that piece of, sourdough bread at the Cheesecake Factory, just eat it at the end, and it's going to have a totally different metabolic effect on your body. This is really interesting too. When you eat carbohydrates also makes a big difference. We know that carbs that are eaten at lunch have a lower blood sugar spike than carbs eaten at dinner. Again, this is even if you're eating the exact same amount of carbs, just changing the time of day when you eat them changes the resultant blood sugar spike. And why is this? Because all of our hormones follow a circadian rhythm. And there's certain times when certain hormones should be high and certain hormones should be low. And we know that our body is less sensitive to insulin in the evening. So our body handles insulin and carbohydrates better earlier in the day. And I think this makes sense because humans are like cars, right? We all need fuel, and carbohydrates are our fuel. And just like you would want to fill up your gas tank before you go for a really long drive, eating your carbs earlier in the day is equivalent to filling up the gas tank, because that's our energy. So you put the energy in before you need it, and you metabolically end up being a lot healthier. There's this cute little saying, eat breakfast like a king, lunch like a prince, and dinner like a pauper. And I think this really rings true. You want to front load your day as much as possible. Now, it might not be possible for you to eat breakfast as your biggest meal, but at least making lunch bigger than dinner is always a good thing. And finally, why are the carbs being eaten? I'm not going to get into this too much, but I just want to address the fact that, emotional eating is real. And in depression, there can be a vicious cycle that forms. So it's always looking at, like, is someone actually hungry, or are they eating for other reasons? So all of these ways to mitigate the effects of carbohydrates is one of my favorite things to tell my diabetic patients, because again, I don't want to take carbs away from them, but I want them to eat carbs smart and eat them strategically. So this is a handout that I give my patients. And again, it's available for anyone to download and use for their patients as well. With all this talk around carbs and sugars, some might ask, are artificial sweeteners the answer? Is this a way to get all the sweetness without the bad effects? This is cutting edge research. It just came out in October, published in JAMA, which interestingly looked at all processed foods and their association with depression. And what they showed was that artificial sweeteners and artificially sweetened beverages topped the list of the foods that were most highly associated with decreased mood. So I thought that was very interesting. As for why this might be the effect, I think it's because we know that artificial sweeteners feed bad bacteria. So that might be how the artificial sweeteners are having this negative outcome. Also, sugar sweetened beverages and artificially sweetened beverages often contain caffeine. And I'm not going to get into caffeine in too much detail here, but we know that caffeine can also propagate anxiety. So that's an important thing to keep in mind as well. So let's recap. Sugar and refined carbs. We know that sugar makes us happy in the short term because it contains dopamine, but in the long term, blood sugar spikes can ultimately lead to the release of adrenaline, which can fuel anxiety and fear and worry. But the good news is there are many ways to lessen blood sugar spikes. You can choose low glycemic index carbs. You can combine carbs with protein and fat. You can eat a salad prior to eating carbs. You can eat carbs at the end of your meal, and you can also eat carbs earlier in the day instead of later in the day. So people always ask me, what's the secret to healthy eating? And the reality is there is no secret. It is very simple. It is very straightforward. In 500 BC, Plato talked about nutrition, and he basically said healthy diet consists of barley, wheat, legumes, fish, and olive oil. Treats to be consumed in moderation are meat, confectionaries, and wine. This was the truth in 500 BC. This is still the truth today. It's not that complicated. It's very straightforward and very commonsensical. I always like to address my nutrition philosophy and to help people understand like where I come from with respect to all of this. And ultimately, my nutrition philosophy, first and foremost, is rooted in balance. And this is what balance looks like. As much as possible, when we sit down for a meal, we want about half of what we eat to be vegetables, ideally, about a quarter to be carbs because you need energy, and about a quarter to be protein. Every meal isn't going to look like this, but the more that you strive to have your meals look like this, the better you're going to be. And this is what food guides often look like these days. Also, it's really important to know yourself. Everyone's ideal diet is different, full stop. What's right for one person is not going to be right for another person. And there is no magic solution that's going to be a one size fits all. So it's about knowing yourself and finding something that works for you. Nothing in excess, really simple, right? That is always something we need to keep in mind. I think structure is really important. As we saw today, the order that you eat foods in, the time of day when you eat foods makes a difference. So having that structure to how you eat can be really helpful. Most importantly, we have to respect our taste buds, because if you are eating really tasty, salty, sweet foods all the time, you can't enjoy and appreciate the more nuanced flavors of things like vegetables. And finally, make treats treats. There's nothing wrong with having a treat here or there. You just don't want treats to be eaten every day or all the time. So we have talked about a lot of stuff today, and I want to quickly recap the most important messages. So we started off by talking about Robert Burton, who in 1621 identified that there are a lot of factors, including diet, that influence depression. And we saw research that shows that the Mediterranean diet can be as effective as antidepressant medications. We saw that part of that is because fiber is very important for mental health, because the more fiber you eat, the lower your risk for depression. We talked about how the fiber feeds the good bacteria that also talk to our immune cells, that ultimately talk to our brain, and can also ultimately influence our serotonin levels. Probiotics are a way to sort of a shortcut to this process, and probiotics have been advertised as a way to influence mood since the 1930s. Fermented milk also contains probiotics, and randomized controlled trials have shown that it has some effect, albeit a modest effect, but almost as much as antidepressant medications. And finally, if you want to fix the brain, you have to feed the gut. We talked about dark green leafy vegetables, how they've been a staple of dietary recommendations for really almost a century at this point, and how most of us are deficient in vitamin A. But the body converts beta carotene into vitamin A. Carotenoid-rich vegetables, including dark green leafy vegetables, are a great source of beta carotene. The more carotenoids you eat, the lower your risk for depression. But you can absorb carotenoids without fat. So you got to remember, Popeye, always eat your dark green leafy vegetables with some kind of fat or olive oil. And this is a staple of the Mediterranean diet. Finally, we talked about, or not finally, but next we talked about omega-3 fatty acids and how for most of North American history, people ate saturated fat, but this changed with the invention of the mechanical screw press, because then people started eating seed oils, which were very rich in omega-6s, and then we subsequently became more omega-6 rich as a species, because we literally are what we eat. We talked about how omega-6 fatty acids then get taken up into the membrane of every cell in the body, and then can get released and talk to our immune cells and stimulate that same process of pro-inflammatory cytokines that ultimately reach the brain and influence serotonin levels. But the good news is omega-3s are anti-inflammatory. They are the fire extinguisher that put out that pro-inflammatory fire. And this is why fish is recommended in the Mediterranean diet. And most importantly, though, not all fish contain omega-3s. You want salmon, herring, mackerel, sardines, and anchovies. Then we talked about carbs. We talked about sugar and refined carbs, how they lead to the release of insulin, which because hormones are like dominoes and one always leads to another, ultimately leads to the release of adrenaline, which can fuel our anxiety and worry. We talked about how food does make us happy in the short term, but in the long term, you get this epinephrine or adrenaline spike. But there are ways to take that spike in blood sugar and lessen it. And that includes what kind of carbs are being eaten, which we can be guided by the glycemic index for that, who the carbs are being eaten with. So things like protein, fat, even cheese and butter can help in that department. How the carbs are being eaten. So having a salad with vegetables, oil, and vinegar can significantly lower blood sugar levels. Also, the order we eat the food in and how we eat it. And then finally, when the foods are being eaten. We know that the time of day matters. Eating carbs earlier in the day has a lower spike than eating carbs later in the day. I like to make everything into a prescription because when you're a doctor, that's what you do all day long. So if I put all this into a prescription, this is my nutrition prescription for how to influence mental health with diet. You want to feed yourself one fiber-rich food at every meal, eat dark green leafy vegetables every day, and don't forget to combine them with olive oil. Eat at least one orange, yellow, or red vegetable every day. Eat omega-3 rich fish 2 times per week, minimize sugar intakes, and eat your carbs strategically. I also have a nutrition prescription for depression and anxiety handout that's available. Anyone can give to their patients if they want, that really summarizes everything that I talked about today. And finally, all of my nutrition prescriptions are available on my website, nutrition-prescriptions.com. And if you're interested and want to learn more, I have some other places where I have some various content. So thank you so much for listening. I hope that this was interesting and enlightening. I hope that you could take some messages from this, not only for your patients, but hopefully also for yourself. So thank you. And if anybody has any questions, I am more than happy to answer them.